Good afternoon, everybody. I'm very honored to be here today, and I'm really inspired and motivated by all the presentation that I could listen to from the beginning of this conference. So thank you so much. Today, I would like really to focus my presentation not so much on evidence-based policy per se, but really trying to start a discussion about how we can better link evidence-based policy with its financial impact. So my presentation today will cover 5 different points. I will start by sharing some case studies of my work in the UK and in Australia. One from taxation, another one on reducing prescription of antibiotics, and another one on saving hospital money. Finally, I will talk about a way in which we can really calculate return on investment to better link evidence with financial impact. And I will close by sharing my personal reflections on the limitations and challenging of policy experiments, especially challenges in scaling what works. So let's start with a case study from the Behavioural Insights team that has been cited quite a lot during this conference. So I had the honor to work in London in this team years ago. And one of the most known experiments, policy experiments done by this team was in the taxation space, where with only one single letter, the Behavioural Insights team helped the taxation authority to collect an extra £200 million in tax debts in only 1 year. So how did they do that? Well, it's very simple. They just add one single sentence to the existing letter, which was they told people, well, 9 out of 10 people pay their tax on time. So this is what we call a social norm. And so these were the results. As you can see in the control group, only 33.6% of people pay their taxes, while in the intervention groups, so people who received a letter designed by behavioral scientists, the percentage of taxpayers that pay tax in time increases significantly. This is really one of the most famous policy experiments done in very early days. One thing that I've been asked very often is, well, these are great examples, but does this work everywhere, or is it something really related to a specific context? So could it be the case that it's only because we are testing these on UK citizens that these policy experiments are working? And so the Behavioural Insights team decided to test similar experiments around the world. And so I'm sharing this here, just one example of these. So they tried to run exactly the same experiment in Guatemala with the World Bank. And very similarly, what they found was that the control group was the group in which people, taxpayers, paid less taxes. Well, for the intervention groups that receive social norms and other behavioral techniques, the percentage of taxpayers that paid tax increased again. And the difference between the worst performing letter, so the one that you see in the control group, the difference between the worst control letter and the best performing letters, when rolled out nationally, is over 300,000 American dollars of savings. So that's pretty impressive. So lesson learned, this doesn't work only in the UK, but actually it has been rolled out and replicated in multiple countries. Now I would like to share with you a different case studies from my team when I was working in the federal government in Australia. And I chose to share this with you because it's a policy experiment where instead of changing the behavior of citizens, we try and change the behavior of medical doctors. So this was the report, and the problem that we had at hand was that in Australia, compared to other OECD countries, medical doctors prescribe much more antibiotics, unnecessary antibiotics, compared to the average of OECD country. This is a problem because we know that the more we prescribe antibiotics, the more bacteria will develop resistance. So this is not only dangerous for Australian people, but for the global population. And so the policy problem was really an overprescription of unnecessary antibiotics. So for example, for viruses that we know that it's not useful. So we use a similar technique as the one I showed before for taxes. So we use social norms, and we design different letters that discourage overprescription. And finally, we run a randomized control trial to test the new letters against the business as usual letter. So we focused on the highest prescribing medical doctors. So we focused on the 30% highest prescribing medical doctors. So this is an example of one of the letters that we sent. As you can see, we added one sentence about social norms saying, well, you prescribe more antibiotics than 90% of your peers. And as well, we added a graph to make this very salient, where people were able, where medical doctors were able to see themselves here in red compared to the average of their peers. So this is nothing but social pressure. So these are the results. This is the pre-trial period, and I'm plotting all the different intervention group all together. As you can note, during the winter months, so from June to October, of course, there's an increase in the prescription of antibiotics, which is absolutely normal. And then it goes down during summer. Well, when we send the letters, so you can see this, the trial period, what happened is that this, the policy outcome really changed completely. So as you can see here in black and in pink, you see the group that didn't receive any letter and the group that received a massive education campaign. And as you can see, their prescription was still very high. While for our intervention groups, medical doctors were prescribing much less. To facilitate the results, I'm plotting here the results on average across the whole period. And as you can see, for the letter that I just showed you with the graph, we were able to reduce prescription rate by 12.3 percentage points. And this is equal to more than 100,000 less prescription, which is a lot of money for government. Another interesting aspect about this trial is that one of the ongoing issues that we have with policy experiments is always the question of, well, is this a persistent effect? What will happen in 6 months or 1 year from now? How can we know that? And I really like this example because actually we were able to check what happened in the next season. So as you can see here, you see here it's when we send the letters. But then when you look at the year after, so in 2018, we were still able to see a difference in the control versus the intervention group. This means that medical doctors who received a letter 1 year, they were still prescribing less antibiotics in the year after. So here I'm plotting the effect sizes across time. And as you can see, from one season to the other, we'll still have an effect. So this is pretty amazing because by just sending one letter, we were able to change the outcome of a policy for more than 12 months. Now I would like to share with you another case study from Australia, this time from Victoria. And really our mission for this project was to save hospital money. So the problem that we had at hand was that, I don't know if it's the same in Korea, but a lot of people book in hospital appointment with the public health, but then they don't show up to the appointment. So they miss their specialist appointment at the hospital. And so we designed a letter where it was a reminder letter where we also included a map to support patients to find their way to the clinic. And the patient in the control group didn't receive any letters, so business as usual. So we found that patients who received a reminder letter were 32% less likely to miss their hospital appointment. And that's what you see just here. So we were able to decrease the non-attendance rate by 32%. And so these result, if scaled, this reduction in missed appointment represents more or less 1.68 million per year. It represents more than 9,000 preventable non-attendance per year, which from the public health perspective, it's very important. And in terms of return on investment, this specific experiment had a return on investment of 9-1. So pretty impressive. And now I would like to stay on the topic of return on investment, because I think it's really key to make the link between evidence and financial impact. So as I'm sure you're all aware, a return on investment is nothing more than the ratio between the impact of a certain policy and its cost in terms of financial cost. Well, the beauty of running policy experiments is that you can compute these in a very, very robust way. And so the way in which we do that is by basically computing the ratio between the effect size and the cost of the trial. And in my knowledge, one of the best references to do that in terms of meta-analysis and looking at what happened in the world is this article that I just cite here from Shlomo Bernazzi and colleagues. And of course, we don't have the time to go through that, but I selected one example that I think is quite striking. That these authors present in the paper. So now imagine that you are trying to come up with a policy to try and encourage people to get vaccinated for influenza, to get a flu shot. In this analysis, on the top, you see the example of a traditional policy where basically they did two things: an educational campaign to tell people that getting vaccinated is important, and they provided free vaccinations. And then they had a more behavioral informed intervention where instead of using financial incentives or education, what they did is that they just changed the emails that employers were sending to employees, really to prompt employees to write down the details about when they plan to obtain vaccination. This is something very common sense, if you want, but it's really a powerful technique to encourage people to do things. And so when you calculate the ROI, so the ratio between the effect size and the cost, what you discover is that the return on investment of the financial incentive was so that only 1.07 additional people get vaccinated for every $100 spent. So you spend $100 and you have only more or less one additional person getting vaccinated. This for the traditional intervention. With this other intervention with planning prompt, what they found is that for $100 that you spent, you will get 12.8 people, additional people who will get vaccinated. So I really like this example because it's just a very clear way to show how for the same policy outcome, you can have different return on investment and different financial impact. And the beauty of running randomized control trial and having a real counterfactual in generating evidence is that you can be very, very precise in the way in which you you come up with the financial impact of your policy. Now let's talk about limitations and challenges. So these are personal reflections. But I would say that one of the biggest challenges in running policy experiments is scaling them. What does it mean? What do I mean by scaling? Well, scaling is nothing else than really transforming a policy experiment, so you see on the left, to something that is generalizable to your whole population. So let's take, for example, you run an experiment on increasing vaccination in one neighbor in Seoul. You found that it works really well. And so the next stage is to implement this and to scale up this to other neighborhoods in Seoul. And so my experience is that it's not always the case that policy experiments that are really successful eventually get implemented and scaled up. So this is really problematic because there's a lot of evidence in around the world of things that we know work well, but they don't get scaled up and they don't get implemented. So this is a major issue. So it's something that I'm passionate about. And so we work together with Monash University to come up with a toolkit in which we did a massive review of published evidence, but as well, we interviewed people. We interviewed experts in policy experiments around the world, really to identify the factors and activities that influence whether experiments will be scaled or not. And I encourage you to look this online. It's completely free and open access. And just to summarize a little bit, some of the reasons why experiments can fail to work when scaled. First is definitely external validity. So something that can work in one context, maybe it doesn't work in the other context. So that's why it's really important to test the same experiment in the UK, but also in Guatemala if we want to make a policy recommendation. Another problem is diminishing returns. So imagine that maybe the return on investment, the efficiency was really good at the very beginning, but then this reduces over time, maybe because you need more resources or you need more logistics to run the policy. Another thing that is very important, sometimes missing, is sometimes there's insufficient investment from stakeholders. So it's really important whenever we run a policy experiment to start and mobilizing commitment from the people who eventually will implement the policy experiments very early on. And finally, as well, backfire effects. So we should always remember that sometimes what encourages positive behavior in one setting can reduce positive behavior in a different setting. So all these are just an appetizer of the kind of evidence that we collected. But this is just to give an idea of why some of the reasons why policy experiments can fail to be implemented. I would like to share with you a personal thoughts as well on evidence. So I've heard a lot about the RCTs being the gold standards of evidence. But my view on that is that there is no simple answer to the question of what is the best method. To me, it really depends on what we want to know, for what purposes, and in what context we envisage that evidence to being used. So I'm a bit advocate of moving a little bit beyond the pyramid of evidence, but more towards a matrix of evidence, where we will just use the best method for the questions and the policy issue at stake. Because I'm convinced that to maximize impact, we should always try to choose the method that has the power to change views, because the evidence we produce only becomes scalable when it attracts advocates for the message it contains. So producing evidence is great, but we really need to be very mindful about how to scale this up as well. So in summary, I hoped I gave you an idea of some of the work I've been doing around the world, some ideas on how to calculate return on investments and financial impact of policy experiments, and finally, some of the limitations and challenges that I have encountered. So what's next? I would just like to finish by giving some quick ideas for the future. I really believe that there is infinite potential for Korea to leverage policy experiments. Korea, for example, is I think one of the best, I think the best country in the world in terms of waste management. And you're doing an amazing job. However, I think that really generating evidence with experiments and counterfactual can really provide you with a robust evidence to make sure that you maximize the financial impact and the return on investment. Because a policy sometimes can work really well, but it can also be very expensive. So it's really important to come up with the most efficient possible policy, as it has been noted before. And this is our list of references, and I thank you for your attention, and I'm really looking forward for the discussion. Thank you.